A 50-year-old man with beta thalassemia comes in with dyspnea on exertion. He received a transfusion 1 day ago. Vitals are normal. Crackles are heard on exam. Echo shows dilated left ventricle with ejection fraction of 40%. He's diagnosed with heart failure and labs are shown hemoglobin of 13, white blood cells of 7K, ferritin of 400. What is the cause of heart failure in this patient? A. High output cardiac failure due to anemia. Iron overload cardiomyopathy. C. Endocarditis. D. Pulmonary edema. So I'll let you answer the question and then I'll explain in 5 seconds. Okay, so the answer is going to be B. Iron overload cardiomyopathy. So this patient has received multiple blood transfusions. So they gave you a hint with saying they received a blood transfusion recently. However, they could have made it harder by just saying that the patient has beta thalassemia. And then in that case, you have to know that the treatment for beta thalassemia is receiving regular blood transfusions. Now, since they told you that, essentially you can take this and also know that when you get regular blood transfusions, one of the complications of getting regular blood transfusions is iron overload, because each time you get transfused, you intake iron. And the problem with iron is that it's actually very difficult for your body to get rid of iron once you take it in. And the only way to get rid of it is essentially phlebotomy, which is the removal of blood. And so we have here iron accumulation in multiple organs once you ingest too much. And so it can go to organs such as the liver and the heart. And so it can be an acquired problem due to multiple blood transfusions, but it can also be due to genetic disorders like hereditary hemochromatosis. And so that's generally seen with a ferritin level over 300, and having an echo study done on these types of patients will show you either a normal heart or dilated or restrictive cardiomyopathy. And heart failure, in this case, due to this iron overload, can be treated with ACE inhibitors and beta blockers. Chelation can be used when there is iron overload. So, for example, if it's a patient that has way too much iron in them in an acute setting, you can typically use chelation to help stop the acute phase of the problem. And then if it's a chronic issue like hemochromatosis, you can use routine phlebotomy to help get rid of some of that excess iron. And so for the other answer choices, we have long-standing anemia, which can cause heart failure. However, in this patient, it's not the case because they clearly give you that he's had multiple blood transfusions and plus his hemoglobin was actually normal. So it's not long-standing anemia. And how anemia can cause heart failure is that since you have less red blood cells, which their main purpose is to transport oxygen, if you have decreased oxygen perfusion to all of your body, your heart is going to compensate by increasing it. So you're going to start having a tachycardia to help compensate for that decreased oxygenation, and then that's going to lead to a high output heart failure. The other answer choice was heart failure, was pulmonary edema. But the thing is, heart failure can cause pulmonary edema, but blood transfusions don't really cause fluid overload. You're not giving so much blood transfusions that you're going to end up with a pulmonary edema. And so pulmonary edema can't cause heart failure, but heart failure can lead to pulmonary edema. And so the final one is transfusion endocarditis. So this is pretty rare and so to start off, transfusion endocarditis is when you get essentially a bad batch of blood that's been contaminated with a virus or with bacteria. But this is pretty rare because blood is screened and stored at very cool temperatures. So it's very rare to get contaminated with blood because there's such a rigorous process to make sure that it's safe. And so going back, so for this question, essentially the key here was the ferritin level over 300. So since it's 400, it clearly shows that this patient has potentially an iron overload, and then seeing that they have beta thalassemia and they've been getting routine transfusions just leads more probability to them having this condition. So I hope that helped, and thanks for watching.